until I will take hold of the chat, whoever has a question and can go rapidly and start asking, do it. Helena, would you like to start?
Thank you, Irit. I was just wondering if anybody, I don't know who, who the audience, the constituents of the audience are, but I come from a Lacanian perspective, and I'm very much interested in the fact that, there are some parallels there in what you're speaking about with Lacanian Lacan's early work on the mirror stage. I was just very much noticed that almost everybody who's speaking is using visual metaphors the whole time. Even yourself, Irit, you were talking about, the focus, the zooming in, the zooming out, the theatrical binoculars, and also that people are, even the client himself, the patient himself is talking about seeing himself. So everything is revolving around a kind of visual thing, and if that itself has any neural correlates. Lacan's early paper was on the mirror stage, looking at Henri Walland's work on, the reaction of human infants with their image. And I know it was seen then at the time as a particularly human thing, and not registering, the same thing was not possible in animals, for example. But it's since been found that actually, yes, you can see the higher bonobo or gorillas, or who will also be noticing and playing with their own image. So I just wondered about that. It's just a question. It's a very abstract question. If there was if there's something neurologically attaching to the visual, actually, where even I'm impressed by the fact that this client, he was speaking, and he was speaking. So who is speaking? If he's outside of himself, who is speaking? And then the fact that, deeply traumatized people who've suffered terrible traumas in their childhood will sometimes just become incapable of speaking at all and have nothing to say. You were describing that very well in the loss of any possibility to go in and out, to connect. The whole connection with yourself as a therapist will be completely broken, and it's as if you have to be on a kind of a parallel line. It's almost like people on two rails of a track. The train is going along this way, but the rails are completely broken off now. There's no back and forth. There's no. Anyway, that's my comment. Thank you.
Anyone want to respond? Or yes, Francesco, please unmute yourself. You can unmute yourself, though. Yeah.
Yes. Well, of course, these comments regards exactly the I will say the making of a mind on the part of the ambience, in the sense of the environment. Human environment or other kind of environment eventually. But the point is, of course, mirroring has been implemented, I would say, from all the study about baby, mother-child resonance, attuning, synchronicity, that is something happening actually from almost from the womb on, in the sense that at the delivery and the first really weeks of life are essential, we know, for the switching on of several circuitry of the brain, especially the social brain has to be activated from the outside, from possibly affectively touching human being. That's make a big difference, we know, about the people being able to stay with others or not. For example, in the case presentation, it's quite evident that these people have been suffering from isolation, and probably this could have been also a kind of family issue. Probably all this going to the mass all together was already felt, as it seems to be, by this very young boy as something constraining, not really warming, no? regarding the affective touch. So of course, it's all a fantasy, but it's actually his main issue regards his limited capacity to be together with others, that then transforms, or as the other face of the coin, also this incapacity to be in contact with himself. No, there is this mirroring in this sense. Okay, I'll stop here.
Rosa, please unmute yourself.
Yeah, thank you. No, just one thing about Lacan, the mirroring. I think we are not here with my patients. We are not in the field of mirroring like Lacan wrote. Because if you consider what Paul Moore said about the representation of the self, we have this double representation of the self in the cortex, in the mantle of the cortex, okay? And this is the homunculus, we call this, okay? And this part of the cortex is related to the images, the image of the self-image. And I think when Lacan talks about mirroring, he's talking about image of the self, how we build our image of the self. I'm talking about the scaffolding, the structure of the self. Maybe I'm talking about the subcortical representation of the self related to insula, related to hippocampus for the memories, related to the world inside, not related to the image of the self. The image of the self is a construction who comes after this early structure of the self, the continuity of the self, the unity of the self, the scaffolding of the self.
I'll say something in short from developmental perspective. No, first let me say something. I find that this is just beginning of a discussion, and I feel like we could go even more and bring in some other articles on the way. But I want to discuss, just answer one thing, going on with what Francesco and Rosa was saying, and it is I was thinking from your question, what is the like the visual system, and what is doing with the other systems, and how is it connected? And I was thinking about amodality, and the idea that, you know, I suppose you know this, like baby 3 days after being born, given to suck a dummy, 3 different ones. He's doing it with his eyes closed, and he's sucking the dummy. And when you take off his the clothes from his eyes, he will recognize the dummy that he was sucking while not seeing it 3 days after he was born, meaning the amodality of the senses, meaning that you know what you see. You know it beforehand. You know your mother from the inside to the outside, and the modalities do change and take place each other. I'm using it as the imitation of the different modalities of each other inside the body. This is the group of senses that, you know, they are co-create the concept finally. So it's a very small addition, and I believe there is a lot of neuropsycho papers concerning visualization and understanding brain visual systems. We had it with Rafi Malach in Israel, who was working about it, but I will not be able to cite all those things. So I just propose, Paula, that we have some other meetings, and propose that maybe we'll add to the people who listen to us papers that come to our mind. We'll use this list to send them. Okay? So, Paul, you wanted to say something?
Yeah, just
okay.
Hi, Helena. Great question. What comes to mind for me is that, you know, just maybe to develop on from what Rosa has said, that actually this is, you know, I suppose the idea that it's the visual imagery that's most kind of prominent in the presentation and in our minds. I think that's interesting, you know, because I think in a way that is where we are with A. You know, he in some way there's an impairment from that step from, you know, what Freud called object presentations, thing presentations, which maybe visual images are part of that, to the development to word presentations, and which gives us the ability to actually, you know, kind of think more strategically and more abstractly about the things that are in the objects that are in our, or the contents of our consciousness. I don't know enough about Lacan, but I'm curious to know, is the mirror stage, what time does, or what stage of development does he propose that the mirror stage happens, Helena?
Well, it was he was talking about research that had been done in the 1930s. So it's way before there's any sort of brain imaging or anything. It was just observing children with their reflections and noticing that they were not interested that much in their reflection in a mirror until around the age of 18 months. And at the age of 18 months, there was a difference and they would look in the mirror and see themselves. This is how it's described. The child would look in the mirror and see themselves, and then look back to the parent, look back at the mother behind, as if checking something out. And it's a kind of he did change his, he saw this as something about the constitution of a separate self, and suddenly checking out a sort of psychological moment where this other was seen as a rival. Actually, this other in the mirror is this which is it that the mother is interested in? My image of myself, what she perceives or projects for me, and what I am myself, and that there's something of a mismatch between what's seen in the mirror and what remains on the side of the mirrored. That there's something which is never reflected in the mirror, and that this, Lacan built his whole idea of subjectivity up around that. I mean, he changed then, he moved on to talk about how the symbolic order, that would be the world of, I'm trying to hook in with the vocabulary today, that would be how the representations are integrated into or intricated into this mirror, so that you have a it was all done without the backgrounds of the neural, you know, the fact that there's actually a brain. He was trying to explain how you have the imaginary, the symbolic, and the real, and that these would be intricated into each other to constitute a self, so that if there weren't these symbolic things, and if the response from the mother wasn't of a certain attunement and respect, I suppose is the other thing, the respect for the child's otherness also, that the child could be left in this position of a very precarious position in the social. So that there was always the risk of the other having more consistency than the image, in other words, having more consistency than the felt, lived reality of the self.
Coincides with the onset of language, 18 months, and that's suggesting that, you know, this movement from object representations only to word representations, and maybe the ability then to link the objects together. And come to an understanding that there's a self there, that this is related to the person. That's all I wanted to say.
Okay.
Okay. Francesco, would you mind?
Yes, it's just to stress the fact that the visual channel is the most built up of our channel of sensory system, while actually I believe that the core self is built upon the other senses. They are more in direct contact with the outside world. I mean, of course, affective touch is essential, but there is also smell, good, what you say, I mean, all the other channels. They are much more present and perfectly functioning at the beginning of life.
Yeah.
In fact, there are many studies in which the newborns immediately recognized their mother by smell, by the taste of the milk, but also by the taste of licking the skin of the mother. Yeah. From the womb, all these information are already inside the baby's mind. Of course, not the cortex in this sense, but probably more phylogenetic old part of the brain. That's essential. Why? Because, for example, affective touch is something that cannot be really, let's say, taught from outside. It's a matter of experience. It's the procedural memory of the mother in the interaction with his own baby. We know that all the deep damage of the self are transgenerational. So the site, yes, is brilliant, the work of Lacan, but is no more, in my opinion, updated with the modern study of what are called the minor senses. Actually, these minor senses are still alive also in humans. For example, in the choice of the partner. We make the choice according to our smell, to our taste. There are very deep memories linked to that and affectively charged, much more than visual images. That's my opinion. Thanks.
Can I say something?
Yes,
I apologize, but the host blocked my video, so you cannot see me. Let me see. Okay, here I am. I had something in mind. Thank you for all the wonderful things you said us. I had this strange thing in mind, which is not the core of our meeting, but is this, that just when we reach a good enough integration of the sense of ourself, the representation of the different layer of our personality, then just in that moment we are able to start to doubt about reality from epistemic point of view. This because the most interesting function of our mind, I think, is to have doubt about reality and about ourselves. But this you can do only if you have a core sureness about who you are and the different part of your personality, and existential sureness base. Thank you.
Thank you. Thank you very much. And I'm looking at my watch, and I know that there are two questions still on board. One is Claudia's questions about medication, which was left unanswered. And the second question that comes out repeatedly in the chat is a question about countertransference and transference of this patient. So I wonder whether you are going to take it, this transference, countertransference, in your presentation, because we are now going to your 10 minutes of concluding remarks. Will you do that? So then, yeah, if you do that, then I let like some minutes, a minute, for Claudia's question about medication. And so would you like to open it up, Claudia? No, you just muted yourself. Yes.
Okay.
Good.
Yeah. Now, does it work?
Great.
Yeah.
We hear you.
First of all, I would like to answer to Gianfranco Bonfiglio, because you were speaking about the possibility to doubt about reality. And I think that this is related to the question of the meta-representation and self-awareness, because unless you reach this capacity of self-awareness, it's not possible anymore. It's not possible to doubt about reality. So the two things are closely linked. And again, we are in the area of the extended consciousness of Damasio, if you want, because you need for the higher order representation to be able to understand about yourself and the environment. And as for the pharmacological question, what I was saying is if it would be useful or not to put this patient, the Rosa patient, under medication would be useful to try with his antipsychotic drugs to reduce his anxiety and reduce his symptomatology, and how would be affect the treatment in regards of self-consciousness disturbance. As I told you, I don't have an answer. I think that I would probably would, but I would like to know your opinion.
I believe that Rosa is the best person to know.
Yes, I have it's clear
She
in
is
my mind. The answer is clear in my mind. I have no problem with this answer because for many questions, for many issues about the drug therapy. So first of all, I never considered these patients psychotic patients. So I could not give him some drug for psychotic patients because I considered these patients a patient with self-consciousness disorder. So means I needed to have these patients in my consulting room, in my session, with all his parts, with me there. So if I will lose some parts of our patients, and this is not a dissociated part. This is not, it was not a dissociated part because he was able to talk about all these parts. Usually when you have some dissociated part, the patient is not able to talk simultaneously, no, with two parts, too many parts. So I would like to integrate all this part in some unity self. So I needed to work with him with all this part. So for this reason, I didn't give him any drug, just for this reason.
No.
I see your point, but I would like very much to know if what is the opinion of the audience, because I'm not so convinced, but I would like to know.
May I say something?
Yes, please.
No, you do.
Just so that you raise your hand, Simonetta.
Yes.
Sorry, I haven't seen it before.
Okay. So no, I just want to, I hope to be very, very short. And I want to start from the first question that Rosa asked herself with this patient is, if he's not within himself, where is the patient? Which I think it's a very interesting question. We can answer from many points of view, from a neurological point of view, from a psychoanalytic point of view, from the setting, he is in the room, but where in the room, he is in the transport, in the counter-transport, where in the transport. So I think that where is the patient is very interesting, because we are talking about a patient who doesn't want to be there within his body. That body is a metaphor, yes, for a space metaphor. And whereas the patient doesn't want to be in the time where he is, which is a different metaphor. And I think this difference between space and time within this patient is very interesting. That's what Rosa was able to keep together and not allow the patient to split consistently between space and time. Because I had many patients, in fact, who, as a defense mechanism, they go elsewhere. They go in parallel reality with especially where they are in analysis during the session. And so I think that being with them within their mind, it's like going somewhere else. And I'm talking about space now and not time, but because the time is the time that we are sharing together. Whereas the space, it's another space the patient is bringing us. And this is the interesting thing. I don't know if I'm clear enough with what I want to say, but the last dream you brought showed that he was able to put together time and space. That is, he allowed you in the car, which is the car of the analysis, and to stay together in a place which was simultaneously space and time together. And this is the important thing, because where are you? Where you're not in your body. You are in your body. Is your body which is not in the space, in the time where you are. And that's the problem, that you don't want to be there because there is a trauma. You don't want to be in this moment. And this
Simonetta, sorry.
That's it.
Yes, sorry. Thank you very much. I think we are at the end of our time. I believe that we can, the people who can stay after the time will have the possibility to speak. I think, Rosa, that you wanted to make some concluding remark. I know that Iris wants to say something from the audience to Claudia. If you can do it like short sentence, a very clear one, if not later. Yes, Iris.
Oh, thank you very much. It's really interesting, and I have so many associations. But just I'm working as a psychiatrist basically, and I'm working in one PTSD team. And this, when we are coming with the medications, I prefer not, because a lot of people who are my patients describe that they are much more detached with the medicaments, detached with the emotions, and we are supposed to do with this like meta things. So just
thank you very much. Rosa, your turn.
Oh my God.
Okay.
Okay. So I thank you very much to everybody, Irit, Paul, Claudia, Francesco, for your very thoughtful consideration. So I think we don't need my conclusion. We don't need. Just I want to give you some more insight, some idea about the dynamic self. And I talked about self-continuity. Now I don't give you any continuity. I give you just some ideas, some suggestion for the future. Maybe we can talk about this in next webinar, okay? So, okay, we talked about the features or some hallmarks of the self. I don't go through this. I give you just some of these features, these facets of the self. And I hope, I wish to conclude with something about the hippocampus, about the memory, okay? So, someone asked to better differentiate, distinguish some vocabulary, some words, what they mean. So, first of all, embodiment. Now, what does that mean when we talk about embodiment? I choose the Varela and the Maturana words, they wrote. By the term embodied, we emphasize 2 points. First, cognition depends upon the kinds of experience that come from having a body with various sensory motor capacities. Second, the biological, psychological, and cultural context in which this capacity develop. Embodiment involves both the perceptual system and the self. Consider this, involving both the perceptual system and the self. According to me, embodied is not only a factor to be added to cognition, memory, just to justify the link between mind and body. Embodiment is a broader concept suggesting that the brain is not only where cognitive processes take place. In the unconscious dimension, we know both memory and self are embodied. But if the body, like Simonetta asked, if the body and the mind do not proceed together, what happens to the structure of the self? Not what happened to the body or other dimension, what happened to the structure of the self? This is the question. Claudia talked a lot about the features of the self. I would like to sum up. Winnicott, Fernberg, Coate, Bromberg, Mitchell, and many others talked and wrote a lot about the self. To sum up, the self can be understood, to me, according to me, can be understood as a mnemonic laboratory with different temporal dimensions like past, present, future, shaped and informed by coexisting childhood and adult life, not only childhood. From this time perspective, the self can be conceived as an extended duration over time. It makes the past endure in the present, which in turn affects the future. The extended duration allows the self to integrate different time scales as related to different functions, motor, cognitive, affective, sensory functions. These functions are held together by this subjective glue. The self is the temporal subjective glue. And the self is a multi-layered structure, and its different configurations appear to be more cohesive or disintegrated, depending on the defense mechanisms. This is not just one defense mechanism in my clinical case. So I don't think we have a lot of selves, many selves. We are just a lot of self-configurations. So, second, the dynamic. When we talk about the dynamic, what does that mean? I followed Richardson and Camero, a really nice paper. I introduced to you a brain in a body in an environment. We call this heterogeneous, complex, dynamical system. This system exhibits emergent behavior which is self-organized, since it does not result from a controlling component agent. If we postulate the existence of the self as object, then we need another self to control this self, another agent to control this agent. No, this is a self-organized system. Dynamical systems are often referred to as softly assembled system. It's not a rigid system. The self is not a heavy system. It's a softly assembled system. For softly assembled system, in the softly assembled system, behavior is the result of interaction between system component, neuropsychological component of the self, agents, subjectivation, and situational factors, environment. It is impossible to separate and isolate the body from the self. The system, the complex dynamical system, cannot be broken down by the predictable behavior of its single components. This is in the complex dynamical system, the computational mind model doesn't work. Another thing, the brain spontaneous activity. I would like to stress this. The brain's spontaneous activity suggests that this cerebral activity is independent, not dependent of specific, externally directed process and stimuli. This means we don't need any object in order to construct the inner reality, because it is a spontaneous activity, who is a self-emergent organized system. So Murray and other people showed that the anterior midline regions, as well as the anterior insula, form a self-network in the resting states, not a self-image, a self-network in the resting states. And this neural overlap between the self And the resting state implies that the cortical midline structure, spontaneous activity, plays a central role in the continuity of the self, in the temporal structure of the self. I think much attention, too much attention has been given to the synchronic self, to the characteristic of the self at a given moment, the content of the self, the object of the self, less to the diachronic self or self-continuity. The cortical midline structure are ideally suited to encode and integrate information over long time scale, not a short time scale like the computational mind, long time scales. This is the self. This process is supposed to mediate an encoding of external stimuli and internal stimuli. This means, in Manos Sakiri's words, this means multisensorial integration. My patients, I would like to say something finally, okay, about my patients. I suggest you to read the Ancelotti paper where he introduced this topic, autoscopy, by analyzing the mythology, okay, the social narcissist, the doppelganger, and so on. The psychoanalytic literature is full of paper on mirroring, the double, the personalization, the realization, dissociation. I would like to go further and delve in the psychotherapy of out-of-body experience, considering the failure to integrate multisensory temporospatial signals, resulting in what? Resulting in a breakdown of the spatial unity between the self and the body. My patients, what's going on in this case? I remind you that the body and the self are subjectivized by being integrated, embedded within the brain spontaneous activity, and this continuous construction of a spatial temporal matrix. Time and space are here constructed in a dynamic way. That is, they provide a connection between different points, time points, in past, present, and future, and space points. This dynamic time, space, points construction makes it possible to continuous ongoing process integrate the different inputs from the body and the self, thus linking, connecting, gluing them up. Our patients suffers from the absence of this experience. I mean, linking, connecting, gluing them up. His self is no longer experienced as continuously present, and this body experience is no longer anchored in specific time-space coordinates. It remains out of time and space. We assume that the integration of the various interoceptive and exteroceptive inputs from his body, the corpora, not the lab, the corpora, are no longer integrated within the ongoing construction of time and space by this brain spontaneous activity. Consequently, the corpora, the body, can no longer be transformed into a lab with memory, with content, with images, which triggers his anxiety, and his corpora is not integrated and linked to himself, and he can shift, the corpora can shift free around the world like any objective object across different points in time and space. He clearly refers and reports to this experience. The corpora is free around the world. What is the lesson we can derive from this case? Corpora, the body, needs to be integrated, embedded within the subjective time-space construction. This makes it possible to subjectivize corpora, which then can be experienced in the slab. The same kind of subjectivation applies to ourselves, not only to our body. If the self is not integrated and embedded within the space-time construction, including its temporal continuity, we will experience ourselves in a discontinuous time frame with lapses of presence and absence, in and out, off and on. Hence, both the subjective self and the body lab are strongly based on spatial temporalization. Otherwise, we will have no access to their experience as such. This means emptiness. Moreover, Such spatio-temporalization extends beyond the physical body boundaries and involves time and space around us, namely the social space and time. This is reflected in our patients' withdrawal, social withdrawal, as well as in the importance of the therapeutic relation. Hence, subjectivation is not only spatio-temporal, but at the same time is also social and relational. And the last one, self-continuity. It's about memory. However, it's not the usual kind of memory that is related to specific object, to specific contents. We call this cognitive memory. We call the other kind of memory is not cognitive memory. The spatio-temporal structure of the self is not cognitive memory. The music, Irit talked about the music, is a form of not cognitive memory. The rhythm of the session is a form of not cognitive memory. And the CM, cortical medullary neural activity, seems to mediate a not cognitive form of memory based on temporal feature, on rhythm of the relationship between mother and child. Finally, I finish. I would like to say something about the hippocampus, just a few words, okay? While we sleep, the hippocampus reactivates itself spontaneously by generating activity similar to that while we are awake. It sends information to the cortex, which reacts in turn. It's a sort of dance. It's a sort of dialogue between hippocampus and prefrontal cortex. This exchange is often followed by a period of silence. The hippocampus call, and then the cortex reply, but there is this short time of silence called delta wave. Then there are again the rhythm of the cortex called sleep bundle. This is when the cortical circuits reorganize themselves to form stable memories. Okay, we know the new information is stored into different types of memories. Neuroscientists call this multiple memory systems. And now they divided the memory system just in hippocampus dependent and non-hippocampus dependent, just two fields. So, Todorov, I conclude. Todorov and Zugaro in 2019 brought out a very wonderful finding. The spontaneous reactivation of the hippocampus during the sleep determine which cortical neurons remain active during the delta waves and reveal transmission of information between the two cerebral structures. Isolating cortical circuits trigger memory consolidation, but only if the isolated activity is relevant to the hippocampal cortical dialogues. So means the hippocampus determines which circuit must be lit up during the dream and during the day and during the memory consolidation. So means the hippocampus works night and day. The memory never rests. And this is the topic of our next conference in 2022. Okay? We will see you in Rome. Thank you very much.